Hi, I'm Danielle Dick. I'm the director of the Rutgers Addiction Research Center, and it's my pleasure to be here today talking with Caitlin Simpson, who is the Senior Director of Addiction Services for Rutgers University Behavioral Healthcare. Caitlin has also been an amazing partner as we have built the RARC in terms of connecting researchers with our clinical services. So thank you for being here, Caitlin. And I would love to start by asking you to talk more about the programs that you oversee at UBHC.
Sure. And thanks, Danielle. I'm so happy to be here to share some of our information and talk about our partnership and all of the programs that we have at UBHC. We have a lot going on right now, which is very exciting. So I'll start with telling you a little bit about our adult substance abuse program, which we call the ASAP program. That program is housed in the Middlesex County Jail. So we're offering outpatient and intensive outpatient services to the individuals that are housed in the Middlesex County Jail. We have a clinician there full time. We coordinate their aftercare, and it's really nice that we can bring that service to them while they're still incarcerated to really help reduce some of the risks that they face when they transition back into society out of the jail. So we have that program running there. We also have programs that operate out of Newark. We have an outpatient program and an intensive outpatient program there. We also have a psychiatrist on staff, and we provide medicated assisted recovery, and we're operating there as well. We have locations in New Brunswick also with an intensive outpatient and an outpatient program, as well as having a psychiatrist on staff and a medicated assisted recovery program there also. And we are pending licensure down in Cherry Hill, where we'll be opening an IOP and an outpatient program also. So we have a lot going on, and are soon to be opening a full continuum of care program up in Plainfield, New Jersey.
So tell us more about that. I know that this is something that there's a lot of excitement about, and it's really an opportunity to have research integrated into clinical care and to have a whole continuum of care there. I believe it's called the Rutgers Center for Recovery and Wellbeing. So tell us more about that and when it's likely to launch.
Yeah, so we're really excited about this program. It's really nice when we can offer the full continuum of care in one location. So meaning that we'll have the full spectrum of all levels of care, starting with inpatient withdrawal management, medically monitored inpatient program, which is basically a short-term inpatient stay, averaging roughly 14 to 21 days, as well as then stepping down to a partial care program, an intensive outpatient program, and an outpatient program. So essentially, clients can engage in our services and remain with us throughout the full spectrum of their care, which is nice because that means their care is not disjointed. They don't have to bounce all over the place. They can really receive all of their services in-house with us for the entire episode of care. This is going to be a great journey here up at the Rutgers Center for Recovery and Wellbeing. We're kind of grounded in three pillars, which is our clinical operations, the research, which we're really excited to collaborate with the research center on, and also training as well. So from a clinical perspective, we really are focusing on wholesome wellness, meaning that all of our care is designed to integrate mind, brain, body, spirit. We really look to leave no stones unturned. We have a co-occurring program. Obviously, the majority of our clients do have some aspect of co-occurring mental health. A lot of them also have past experiences of trauma. So our clinical care really supports all of ensuring that we're providing coping strategies and all of the therapeutic interventions to really address every aspect of the individuals that we're providing care for. Our medical team is comprised of nurses and physicians and psychiatrists that are there to support the medical parts of each of our clients. And wellness is a huge part of our program as well. We are incorporating yoga. We have a beautiful exercise studio where our clients can really focus on their health, their wellness, fitness. Nutrition is incorporated, and all of our therapeutic modalities about the way that we provide care really come from a holistic place. So we'll be including experiential therapy like art therapy and hopefully some music therapy. We utilize dialectical behavior therapy, acceptance and commitment therapy, cognitive behavioral therapy, and a lot of our team is now starting to get trained in CBT for PTSD. So we're really focusing on wrapping our clients with every aspect of support they need to promote a long-term recovery.
So that's one of the things that I've been particularly impressed with your program and the programs here at Rutgers is that we know that very often substance use treatment gets essentially siloed off from treatment of other mental health challenges
Mhm.
or other physical health challenges. And of course, that's not how people are. We know that
Right.
very often there's overlap between experiencing substance problems and depression or PTSD or other kinds of mental health conditions and or other physical health conditions that might be related to and driving challenges that they're having in their lives. And so I think that's one of the things that's very special and should be standard of care, but that Rutgers does well. Do you have thoughts about why that doesn't happen more broadly in the field? What are some of the barriers to why every place isn't looking at treatment in a holistic way?
I think I think a lot of it is really having like that complex understanding of addiction and how pervasive it actually is. I think for a long time, especially when we talk about past experiences of trauma, I mean, I can remember, 15 years ago in the field, it was, oh, we don't talk about, trauma yet. They have to be in recovery for a period of a year before we can talk about trauma. And I remember saying to myself, well, that's kind of counterintuitive because their trauma is really what is driving their relapse and what is driving them to want to continue to use because they don't understand and know how to manage all of those complex feelings that they're having in relation to their past experience of trauma. And what we know about when we look at substance use and trauma is our bodies are the vessels that carry pretty much everything. So how are we supposed to get well if we're not incorporating some of that body work, whether it's yoga, nutrition, exercise, and then engaging our clients in ways through experiential therapy where we might start with, some kinetic aspects of drawing or artwork, and then taking that and incorporating it then into a therapeutic approach. Because when everything is disjointed, we really don't get the best outcomes for our clients. So I think a lot of it was really just needing to kind of gain some of that understanding about the complexities of trauma and of mental health and the connection from that, and really just unifying how that's approached in the field. There's definitely, I think, some barriers of doing that. I don't fully know or understand all of what that is for people. We've always found a way in the programs I've worked in to integrate that care, and really, come from a place where it's holistic and wholesome, and we're really supporting every aspect of that person.
And I think it's really important for people to know that that is best practice. That best practice really is to integrate care. It isn't. So if you go to a therapist and they say, oh, well, we're not going to touch depression, you should probably find somebody else to deal with that. We only work on, say, the alcohol use disorder or whatnot. That's really not considered the best way to treat and help individuals at this point. But unfortunately, it's my experience from talking to a lot of people who've had children and loved ones struggle that they still encounter some of that out there.
Mm-hmm. Yeah, absolutely. And it is, care has to be integrated, including, medical care as well. So, when our clients come to us, we don't only have all of the clinical and medical and wellness perspectives, but we have case management services. So if our clients need assistance with getting to their primary care physician or getting to a dental appointment that they haven't gotten to, our case managers can step in and help our clients coordinate all that care. Because a lot of times those simple things are so difficult for our clients to do and can become very overwhelming, and then can really kind of lead to some relapse behaviors if they're overwhelmed by all these normal life things that they have to kind of remember and relearn how to take care of and manage. So all of our case managers work really nicely hand in hand with our clients to even focus on those little pieces that really are so important. So slowly kind of putting all of those parts back together. So we do a lot of coordination of care as well. So there's really no aspect of a person that should ever be left, uncared for when they're, under our roof receiving services.
So one of the other misunderstandings that I know that is out there about substance use treatment is that very often people will say, "Oh, you mean going to rehab?" And they have in their mind the idea that you're going to go away somewhere for 30 days or 90 days, and you are then going to get better and return to your life. And I know that that is not at all, from talking with our clinical colleagues, considered best practice and or, really the best way to support individuals in terms of long-term management of substance use disorders. So can you talk a little bit about that? Because I'm sure you must have this conversation with folks all the time too.
Yeah, I think the idea of what treatment is and the actuality of what happens when someone engages in treatment can be very different, because there was always like that quote unquote, oh, you go to rehab for 30 days and you're done. And it's really a lifelong journey. And I think on the clinical end of things, part of our job is to make sure our clients engage at the right level of care. And there's all varying levels of care. And what happens is if we don't assess appropriately and if we don't effectively determine what the appropriate level of care is, it can actually do a disservice to our clients. So that initial assessment part and understanding ASAM, which is the American Society of Addiction Medicine, and their varying levels of care and how to appropriately recommend that is a really important part of our clinical work that we do. So typically what happens is based on what level of care they enter in treatment at, the length of stay can vary. It varies on the amount of support that a person has, if they're dealing with co-occurring mental health, if they need to engage in a withdrawal management program, if first they started outpatient. So it really kind of depends. And there's no cookie cutter answer because each person is different and each person will require a different length of stay or a different treatment plan or a different course of treatment. There's really no one size fits all approach. And that's one of the things I think we do really nicely is that all of our care is highly individualized. It is based on the need of that person, what their identified presenting problems are, how we can best support them. So all of our treatment plans are really designed specifically for them and the things that they're working on while they're in treatment.
So I feel exceedingly grateful that I now, even as a researcher in this field, much better understand the clinical landscape, what's best practice. I am blown away by the number of people that I talk to who, when they learn what I do, obviously share their stories of loved ones who have struggled with substance use disorders. And they very frequently talk about the incredibly challenging journey to find good treatment or to figure out, with all of the options out there and knowing they're not all equal, but they often all have glossy websites and those kinds of things, to figure out where to find good treatment. Can you talk a little bit about that, about sort of your advice for finding good treatment, and or how do people end up in treatment at UBHC, where you all obviously have, amazing evidence-based programs?
Mhm. Yeah, when people are looking for treatment, a lot of times they go online and you really have no idea, what's being presented. Is that actually happening when you get there? Because some people have lovely websites and then you get to the center and it's not, actually what's happening. So I usually encourage people to call and have a conversation with the admission center and ask any questions that they might have about insurance coverage, about the types of treatment they offer, the caseload size, the average length of stay, what types of employees they have on staff. Do they have a psychiatrist on staff? Some of those questions, asking, can you walk me through a day at your program and help me understand what that looks like? Simple things like that to make sure that it would be a good fit for you. Because anything that we see online isn't always what it is. So I always encourage people to call. In New Jersey, we have what's called the IME, which is the interim managing entity. And you can call that number and you can let them know, hey, this is what I have going on. I have, these concerns. I'm struggling with this substance use disorder. I may or may not need withdrawal management or whatever issues you have going on. And there's a clinician on the other end of the phone that will go through a brief assessment with you and match you to a treatment provider. So it kind of takes some of that guesswork out. And I think that that's something that New Jersey has that's a really nice option. And they will give you multiple options for places that you can call for treatment based on if you have insurance, don't have insurance, have Medicaid, want to private pay, whatever it is. They can tell you about every treatment option that you have in New Jersey and also provide you a recommendation for a level of care. So it's a really nice one-stop shop, and you know that you're getting really valid feedback from them also. That's also a way that you can access care at UBHC is through calling the IME. And then UBHC, we also have an access center. So you can call the access center, explain some of your concerns and what you're struggling with, and they would match you to one of our programs as well.
Great. And I know that we have the number for that hotline where you can kind of call to learn about different treatment options at the top of our Rutgers Addiction Research Center website, addiction.rutgers.edu, for anyone who's listening out there and wondering. It's kind of right at the top under looking for help there too. So it is one of the ways that I was very impressed when I was looking around about coming to New Jersey and building out the research center. I was incredibly impressed that you all did have that because it doesn't exist everywhere. The other thing that I have learned that many people don't know and that isn't intuitive is that the cost associated with a treatment center is not always correlated with the quality of care. And in many areas, we think of things that are more expensive tend to be better or higher quality, but that's not necessarily the case in addiction treatment. That, in fact, you can be paying a lot of money for fancy locations that don't have evidence-based treatment that actually help with long-term recovery from a substance use disorder. And so I'm curious, you talked about here are things to ask. Are there particular things that you are looking for when you're asking about what kind of treatment, what kind of staff, what are the responses that if you are a parent looking for your child or for your spouse or loved one, what kinds of things should you be looking for in treatment centers to feel better that you are getting quality addiction treatment?
Sure. I would definitely want to hear that they're using evidence-based practices. So they can ask about the different types of therapy that their clinicians might be utilizing. I would probably want to know the level of licensure of their staff. There's some treatment facilities out there that will only staff with, say, a few certified alcohol and drug counselors, which are maybe a bachelor level clinician. So you want to make sure that when you ask, you're asking, do you have a licensed clinical social worker or a licensed professional counselor? So understanding, the experience that their team has when they're providing that care. I would want to know, do they have a psychiatrist, a psychiatric nurse practitioner on staff? Do they address the co-occurring mental health, and how do they do that? I would probably also want to know how they address if there's any medical problems or any legal problems. Do they offer case management to support that, as well as understanding their family program? If we're a loved one and we're taking our children somewhere, or our spouse or brother, sister, and we're bringing them to a treatment center, we want to know what their family program looks like and how they're going to manage that, as well as how their aftercare coordination works. A lot of times I've heard terrible stories about clients like, oh, your treatment is done, so here's a list of referrals, and, we recommend you go to an IOP, and they're out the door. And unfortunately, the client's left standing there having no idea how to coordinate that care for themselves. So really having a comprehensive aftercare team that's going to ensure that the linkage is made to the next provider so that there's no gaps in services, because we know that gaps in services is a huge issue. And can really lend to increased possibility of relapse when they're not linked directly to that next provider. So ensuring that is there. And then what are they going to do for fun with their clients? Our clients still have to have fun. Like being in treatment is hard, and you have to have hard conversations about things that are really challenging. And, a lot of times they forgot how to have fun. So that's a really important part. Is, what activities do they have? Are they including self-help? Are they taking them out, for a fun activity or to go rock climbing? Do they have a movie night? Anything that can increase connection because we know that connection to self and to others is basically the opposite of addiction. You know, when we can connect to other people and when we can relate and we can find common and shared experiences, it really starts to fill some of those voids and allows us to feel whole again. So I think that's a really important thing to ask about as well. And definitely the transparency about insurance and billing and cost, and can they provide a detailed list of charges and what services and things like that, because I think that's sometimes how people get that surprise bill at home. And they are supposed to fully disclose all of their charges, the cost of treatment. That is a regulation, especially in the state of New Jersey, that we're very transparent about billing practices. So that's definitely something to ask as well.
Well, that's so helpful, Caitlin. I know lots of people out there will appreciate that, because when you are, have a loved one who is struggling, I know that you feel helpless in so many ways, and then trying to navigate the complexity that is our medical system
Mhm.
is just, one other hurdle we want to make easier for individuals.
Mhm.
So the last thing I always ask our guests is to talk a little bit about how you ended up at Rutgers. I know that you are even newer than I am, because I was fortunate to watch you get hired, and the tremendous excitement that surrounded bringing you in to really oversee addiction services, to build the partnerships with our researchers to ensure that the programs that we're offering clients at UBHC in the addiction services area are not only evidence-based and best practice, but that we can implement, novel and exciting research findings. And you have been such a wonderful partner on all of those things. So how did we get lucky enough to have you? What brought you here to Rutgers? What is kind of the trajectory of your career?
Yeah, so I've been in the field now for 18 years, working in various nonprofit and for-profit roles. And during the pandemic, I ended up working remotely for an organization called Refresh Mental Health. And it was the first time in my entire career that I was working in a primary mental health organization. I have worked within the addictions field my entire career up until that point, and I was there for about 2 years. And I was like, wow, I really, really miss the substance use field. And I, I I always felt like something was missing at that job. I always felt like a little disconnected. And it's because it wasn't working with the addiction population. And I said, okay, well, let me look and see what I can find, and I'm on Indeed scrolling through 15 pages. And I happened to see the job posting for this job for the senior director with UBHC. And I said, oh, that's so interesting. Like, let me apply. And I went to Rutgers. I got my doctorate at Rutgers. I love Rutgers football. I go to all the football games, so there's a place in my heart there for Rutgers University. And I was like, wow, this would be so cool. And I applied and went on all of the interviews, and I loved all the people I met. The people were wonderful. I was so excited about their plans for growth and their plans for development and really creating a center of excellence for the addictions field, and for their opportunities for expansion and growth and development across the state to really bring quality care to all of the residents in New Jersey. And I think mostly I was excited about the pillars that they set up for the service line, which is the clinical end, the research end, and the training end. Probably most excited about the clinical piece and the research piece, because research was something that we always did very informally, but we always wanted to know, is our treatment working? I'm clinically trained. I'm not research trained, but I was always like, okay, well, we're providing all of these evidence-based practices. Like, I want to know if they're working. I want to know what the outcomes are. Are we improving the overall quality of life for all of our clients that are engaging in care with us? So I was always kind of doing little mini research studies by myself with our teams. And honestly, that's how we decided to integrate all different types of treatment for our clients, because they were our best informers in telling us, hey, like, this isn't working, or we would love to see this. And this was awesome. We need more of this. And they really helped us learn and grow and develop awesome programming. And a lot of that I've been able to bring to UBHC. So I'm so excited about our partnership and all of the exciting things that we're going to get to do up at the center in Plainfield. I'm excited that we're getting to bridge that gap between research and clinical. For me, I think that's probably one of the most exciting things because I think it's really going to allow us to be innovative and to really drive improved quality of care across the state of New Jersey. So that's kind of what brought me here. And it's been probably the fastest year of my life because I've been here for a year. And it's just been really great to meet so many people and to be a part of such a big team and to know that, we're really working towards improving the addiction field across really, essentially, it'll be across the nation. So I'm excited for that.
Well, we are so grateful to have you as a partner. Thank you so much for taking time to talk with us about all the services that you're leading and for all the really important work that you do to help others. So much appreciated.
Thank you. Thank you for having me.